Congratulations, the fact that you are watching this video means that you have a baby on the way. My hope is that at the end of this video, you're going to feel a little bit more comfortable with knowing what to expect during the first 48 hours when you have a baby at Prentice Women's Hospital. It is really exciting when you have a new baby, and it's also a little bit terrifying. So we want to help you as you get acquainted with your brand new baby. We want to help you feel empowered that you have the tools to be able to leave the hospital and care for your child, and also to make sure that your baby is nice and healthy when you go home. When your baby is born, as long as all is looking well, they're going to come up to your chest for those first few snuggles. Your baby will be staying in your room in a little bassinet right by your side the whole time, with nurses and doctors coming in to check on both you and the baby periodically and throughout. You're going to be learning how to feed. You're going to be working on learning your baby's cues. You're going to be snuggling. You're going to be taking all of the pictures. One of our doctors from Town and Country will be seeing your baby every single day that you are in the hospital, making sure everything is going well. And we like to do our exams right in the room so that you're seeing everything that we're doing and you can ask all of the questions that you have while we're checking your baby out in real time. Around 24 hours of life, your baby will go into the nursery for some of their first rounds of screening. We'll be checking that your baby can pass their hearing screen, their oxygen screen, looking at their heart, making sure that the bilirubin or jaundice level isn't too high, and making sure that all of those first vaccines are done. If there was anything that was of concern that were to come up from any of those tests, both the nursing staff and the pediatricians would of course let you know. After the test is done, the baby will meet you back in your room. In addition to the care that's provided from you from the pediatricians in Town and Country and from the nursing staff, there are other services available to you at Prentice, the best of which I think are the lactation consultants. In movies and TV shows, babies kind of pop on and everyone smiles and knows what to do. But breastfeeding, whether it's your first baby or your 10th baby, it's a new mother-baby pair and it's a really hard thing to learn how to do. That takes a lot of practice. So having any expertise from the nursing staff and from lactation consultants is really helpful. There are always breast pumps available as well, should that be something that you're interested in. In addition to the lactation services, there are CPR classes that you can take before you leave the hospital, and then there are also some baby care classes because not everybody knows how to put on a diaper for a baby. While you're in the hospital, someone from Town and Country will be checking in on you and your baby, making sure that all of your questions are answered and making sure that the baby is still doing well. You'll actually be meeting a different doctor from one of the 3 Town and Country offices every single day. So while it might not be the pediatrician that you'll ultimately be following with, it's kind of nice that you'll be introduced to a few of the other physicians within the big group. And it's our hope that as you're getting ready for discharge, you'll know exactly when you need to be following up in the office, some things that we're going to be on the lookout for, things to be letting us know about, and that you're going to feel as confident as you can taking home your newborn baby. All of the records from Prentice Women's Hospital will be shared with your office and your doctors at Town and Country, and they'll be able to review all of the information prior to your baby even coming in for that first well visit. Thanks so much for considering Town and Country Pediatrics. We can't wait to meet you and your baby.